347.
Yeah, just basically you need to use the same code which you will code for arthroplasty shoulder.
Arthroplasty.
Okay, so these are very important for interviews. That's why I am repeating multiple times. Okay, like amputation also. So reamputation means patient will perform amputation in the same area. Okay. So other than same area, if physician performs, that one become normal amputation only again. So it will not become reamputation. Okay. So any doubt? So in musculoskeletal system, arthroscopy is the last section. Okay. So after that, we need to start respiratory system. But this is very, very important. So try to keep your concentration here. Okay. So, okay. Fine. So endoscopy, arthroscopy. So whenever you see any scopy procedures, all will comes under endoscopies only. Okay. So endoscopy is the generic term. Like we are having the anticoagulants. Okay. So anticoagulants in the generic term and warfarin. So all those are brand names. Like here also endoscopy is the common for any type of scopy. Okay. So among endoscopy, arthroscopy is one section. So arthro means joint, scopy means examination. Okay. Arthroscopy. So basically physician will use arthroscopy for both diagnostic as well as therapeutic procedure. Okay. Initially they will start with diagnostic procedure. So if the physician finds any type of abnormality, they will convert into therapeutic procedure. Okay. So as usual, all endoscopy procedure, diagnostic endoscopy includes surgical endoscopy. Okay. So you don't need to code diagnostic endoscopy separately. It is included in the surgical endoscopy. Okay. So when arthroscopy is performed in conjunction with arthrotomy, add modifier 51. So what is arthrotomy, guys? Anyone? So what is arthrotomy?
Incision. Incision, sir.
Yeah, tomy means incision. Arthrotomy means incision.
Joint.
Joint. Yeah. Incision on the
Joint
joint.
incision.
So here the guideline is that when arthroscopy is performed in conjunction with arthrotomy. Okay, so that time we need to add 51 modifier. So that is the guideline. Conjunction with means along with. Okay, if the patient performs both arthroscopy and arthrotomy, we need to append 51 modifier. Most of the time we will not encounter that scenario. No need to worry. Okay, so directly physician will perform the arthroscopy. So we are in CPT na, we are having multiple guidelines, but in a live coding na, so we will not get like those scenarios. So we don't need to worry about anything. Just for interview purpose, you need to learn everything. Okay, for example, if you go to interview, they will ask you. So how do you code if the physician performs arthroscopy along with arthrotomy? So that is for interview purpose only. Live coding, you will not use that one. So that time you need to append 51 modifier. Next. So next one is very important for your interview purpose. So arthroscopic removal of loose body or foreign body. See here, they have mentioned IES for loose body as well as foreign body. Okay. So IES means singular, multiple loose body or multiple foreign bodies meaning. Okay. So arthroscopic removal of loose bodies or foreign bodies may be reported only when the loose bodies or foreign bodies is equal to or larger than the diameter of the arthroscopic cannula used for the specific procedure and can only be removed through a cannula larger than that used for the specific procedure. Okay. Or also in order to code this loose body or foreign body, physician needs to make one separate incision. Okay. So here the guideline is that, so when you go to interview, they will ask you, so how do you code arthroscopic removal of loose body? Okay. So here our guideline is that if you want to code removal of foreign body or loose body, the loose body or foreign body size must be greater than the cannula size. So most of the time cannulas you will see in the arthroscopy procedures. So here the diameter of the loose body or foreign body must be larger than the cannula size, arthroscopic cannula size. Okay. So that is the important guideline you need to remember. Okay. So and here also see here, and can only be removed through a cannula larger than that used for the specific procedure, or through a separate incision, or through a portal that has been enlarged to allow removal of the loose body or foreign body. Okay. So here three keywords you need to check. First one is, so if the foreign body is less than cannula size or greater than cannula size. Less than, will you code or not? If the foreign body is less than cannula size, will you code or not?
No
See the
need to
guideline.
code.
No,
Yeah,
sir.
no need to
No,
code.
we should
Yeah,
not code.
that is the guideline. Okay, no need to code. If the foreign body or this one larger than the cannula only, we need to code separately. Okay, and you need to check separate incision or separate portal. Okay, if the patient performs like a portal enlargement of the portal, so that time you can code. Only if you tell this one is enough. Only cannula size. Okay, so that is very important. So next, we are having few like nearly 5 to 6 anatomical areas using this arthroscopy. So we will go one by one. So arthroscopy, temporomandibular joint, diagnostic, with or without synovial biopsy. So where do you see guys temporomandibular joint? Where is the anatomical?
Head.
Yeah, excellent. Yeah,
Yeah,
head
near.
location. So here basically temporal, temporo comes under like skull. Okay, so mandibular comes under,
The facial bone.
yeah,
Yes.
mandibular comes under facial bone. So combination of these temporomandibular bones are, we will call it a TMJ joint. In the OP reports, most of the time you will see TMJ, temporomandibular joint. Okay, so diagnostic, with or without synovial biopsy. So here synovial biopsy is not mandatory. Okay, so next, arthroscopy, temporomandibular joint, surgical. Okay, so this is the diagnostic procedure. So this is the surgical procedure. Okay, so will you code 800 and 804 at the same session, guys? 29800 and
No.
2980? No.
No,
So
no,
No.
we should
yeah,
not code.
correct. So we should not code based on the basic guidelines of all scopies. So that guideline is not only for arthroscopy, that guideline is common for each and every endoscopy procedure. Okay, so we will not code surgical, sorry, diagnostic arthroscopy with surgical arthroscopy. Okay, so that is the guideline. So and also always you need to check this parenthetical note. See here. So this is the TMJ joint surgical. Okay, so this is the arthroscopy procedure. This is the open procedure 21010. Okay, so next arthroscopy shoulder diagnostic with or without synovial biopsy. Okay, so this is also diagnostic shoulder area. Okay, so for open procedures you need to use all these codes. Okay, so next arthroscopy shoulder surgical capsulorrhaphy. Okay, so what is capsulorrhaphy, guys?
The repair of the capsules,
Yeah, yeah,
bone capsule in the joint
yeah.
area.
Repair of the capsule, we will call it as capsulorrhaphy. As we have discussed previously, every joint is having the capsule. Capsule and synovial membrane or articular cartilage, though these all are common structures you will find around the joint. Okay, so capsulorrhaphy here. So capsulorrhaphy means basically so repair of the capsule. So in the documentation, if you see Bunkat repair, Bunkat lesion repair, so you need to code this one 29806. 1 second. So I will show you this one 29806. See, this is the capsule. Arthroscopy shoulder surgical capsulorrhaphy. Okay, this is the acromion base. This is the coracoid process. Capsule. So this is the capsule and scapula. So acromion bone, coracoid process, capsule, scapula, arthroscope. So here physician will repair this capsule. Okay, so we will call it as capsulorrhaphy. Okay, so most of the time we will use this procedure for Bunkat lesion repair. Okay, write along with your CPT code. For Bankart lesion repair, we will use this code 29806. So if your documentation is having Bankart lesion repair, you need to code 29806. Now we will see what is Bankart lesion. Okay, so this is very easy. If you see the image, you can understand easily. See this one. Okay, so we are having two types of labrum repairs. Okay, so this is the slap repair. 10 o'clock to 2 o'clock, in between 10 to 2, slap repair. Okay, so in between 3 to 5 or 3 to 6, you are having the Bankart repair. Okay, so here Bankart repair, so it is basically repair on the superior portion of the labrum. Okay, so this one you will use this code. What is this? 29806 for Bankart lesion repair. Okay, for open repair you will use this one. For report thermal capsulorrhaphy, using the heat, if the patient performs capsulorrhaphy, you need to use unlisted code 2999. Okay, and this is also very important, 29807, repair of slap lesion. So here for interview purpose you need to know the meaning of slap lesion. Okay, so what is the meaning of slap? Anyone knows? So no worries, just write along with your CPT code. Superior, S means superior, L means labrum. So this is the superior labrum. Anterior, so front portion is anterior and back portion is posterior. Superior labrum, anterior and posterior. So it will call it as slap tear. Okay, so got it guys? So this is very important for interviews. See how it looks like here. So this is the capsule. So capsule got teared here. So physician will perform the Bankart lesion repair here. Okay, guys, got it or not? This one, slap and
Yeah,
Bankart.
got it.
Okay, na?
Yes, sir. Yes.
So
Yes,
this
sir.
is very important for interviews also. They will ask you how do you code if the physician performs both slap tear and Bankart lesion. Otherwise, they will ask you what is slap tear. So superior labrum, anterior and posterior. So it is between 10 to 2 o'clock. So Bankart lesion is 3 to 6 o'clock. So that is very important. So for whether we can code or not, we will check using this real-time scrubber. Okay. So why means if you go to interview, they will ask you. So what is the code for Bankart?
29806.
Yeah, 6.
29806.
Okay. So what is the code for this one? Slap?
29807.
29807.
29807.
Correct. Okay. So we will click here. So what they are telling? 29807 is bundled into 29806. Okay. So you may override the edit with a modifier. Okay. On 29807, if circumstances and documentation support 29807 being distinct from 29806. So tell me, so based on this guideline, can we code both conditions or not? So what do we need
Yes,
to do in
we
the
can
live
code.
coding? So what do you need
Yes,
to
we
check in
can
the live
code.
coding? So that is fine. So what do you check in the live coding?
Whether the capsule lesion repair is on Bankart region or slap.
Yeah. So most of the time you need to check here for medical necessity. So here, if you want to code these two procedure, patient needs to have both Bankart lesion as well as the slap lesion. Got it, guys? So whenever you code any type of CPT procedure, you need to check for what do you call this one, medical necessity. So if you are having the two conditions, two you can code. Okay, why means both are in different locations, correct? So you can code. So like that. So that they are telling here. Okay, 29807 slap lesion is bundled into 29806. But if the physician performs or medical necessity is there, you can append 59 modifier. So that they are telling here. Okay, so based on the circumstances and documentation support. Got it, guys? So with the documentation having both Bankart and slap tear, you can code. Okay. So next 29819 with removal of loose body or foreign body. Okay, same guideline. So if the loose body or foreign body size is less than the cannula, you will not code. If it is more than the cannula size, you can code, and you need to check whether physician has enlarged the cannula site or not, and separate incision is made or not. Okay. Next 820 synovectomy partial. So we will check this one. So as we discussed previously, synovial membrane is also common for each and every joint. Okay. So this is the synovial membrane. Head of the humerus, scapula, this is the clavicle. So removal of synovial membrane partial from shoulder joint. Okay. So this is the arthroscope. So this is the synovial membrane. So here is the synovial membrane. Okay. So here physician will remove this synovial membrane. So it is only partial, not complete. Okay. Inside the shoulder with arthroscope, instead repair the membrane between the bony surfaces and the joint capsule. Okay. So synovial membrane is the joint between bony surface and the joint capsule. Okay. So she inserts instrument and excises a portion of the synovial tissue that has become inflamed. For synovectomy also, so what is the diagnosis you need to check?
Synovitis.
Excellent, correct.
Synovitis.
Yeah, you need to check for
Synovitis.
synovitis. Yeah. So in the in the operative report, if you find synovitis, you can code for synovitis like ICD-10 CM code. Okay. So you need to check the documentation for synovitis. So this is partial. This is complete. So whether physician is removing the total synovial membrane or partial synovial membrane, based on that you need to code. Okay. Next, these are very, very important for interview purpose. 29822 and 29823. Okay. See here, just code description. Debridement limited. One or two discrete structures. 29822. Okay. So 2988823. Debridement extensive. Three or more discrete structure. Okay. So if you got the doubt, what are discrete structures? So these are the all discrete structures. Okay. So whenever you want to code debridement, you need to check the operative report whether physician is performing debridement in these structures or not. You need to calculate the structures basically. Okay. You need to calculate and you need to code. So most of the time you will not code this one 29822. Okay. So this one you don't need to code most of the time, and most of the time few times you need to use 29823. Okay. So you got it, guys. This is very important. So your interview question here is, so along with three procedures we can code 29823. What are those procedures? They will ask you in the interview. So write down 29824, 29827 and 29828. Along with these three procedures we can code 29823. Okay, that is the exception. CMS exception for shoulder arthroscopy course. This is the very important interview code also, or interview question also. So in which scenario you will use? You can code 29823 along with other arthroscopic procedures. So that time we need to tell we can code 29823 along with 29824, 29827 and 29828. Okay. So any doubt, guys, here? Next, in the operative report, you need to check the location. So for example, if you are the operative report, they have mentioned, so I have performed debridement on the humeral bone. So this is one structure. So they will tell I have performed debridement on the biceps tendon. So this is two structures completed. Okay. Next, in the documentation, they will tell I have performed debridement on subacromial bursa. So three structures completed. So that time you will code 29823. Okay. So here one important guideline is, for labrum, whether it is anterior, posterior, you need to take it as only one structure. Okay. For example, if the physician performs in the superior area and inferior area, you can't count it as two structures. It is only one structure. Okay. That is the important guideline. Okay. Next, 29824. Distal claviculectomy including distal articular surface. Okay. So distal claviculectomy we will see here. So clavicle is a very large bone. So if the physician performs distal claviculectomy, we need to code this procedure. Okay. So here we don't have anything. So just see the clavicle here. Let me. Okay, see. This is the clavicle. Okay, yeah, we will see. Yeah, this is the clavicle. Okay, this is the clavicle. Physician will perform the claviculectomy. So that time you will code 29824. Okay. So along with claviculectomy, you can code 29823. Correct or not? Just write down in your book. Okay. So next, shoulder arthroscopy with lysis and resection of adhesions, with or without manipulation. Okay. So this one also most of the time we no need to code adhesions. So we will not use 29825 most of the time. Okay. So frequently we will use this one 29826. So this is add-on code. So you can't code 29826 along with you need to code 29826 along with another procedure. So these are the guidelines for 29826. So you can code this code with 8062, 825, 827 and 828. Okay. So decompression of subacromial space with partial acromioplasty with coracoacromial ligament release when performed. Okay. So decompression of subacromial space. See, this is the subacromial space. Okay. Here physician is making the free for subacromial space. Okay. What is this? 29826. The provider examines the tissue inside the shoulder joint with an arthroscope. He inserts additional instrument and repairs the shoulder blade and coracoacromial ligament to alleviate shoulder joint impingement, which causes irritation and pain. Okay. So write down here. If you want to code 29826, your documentation needs to have shoulder impingement. Okay. So right, this is the shoulder impingement is the ICD-10 CM code. Okay. You need to check the documentation for shoulder impingement. So that time physician will perform this procedure. So you will check any image here. So there is no image here. So that is the guideline. In the documentation, you need to check the impingement and you need to code that procedure. Okay. See here. Is add-on code and must be reported in conjunction with all these procedures. You should not report code 826 add-on code with codes for open repairs. So we need to use, as it is a arthroscopic procedure, you need to use this add-on code along with only arthroscopic procedure, not with the open procedure. So surgical arthroscopy we know already. Okay. So this is also very important. If the provider performs a diagnostic arthroscopy first and discovers he must perform an open repair of previously unknown condition, you can report both open repair and the diagnostic arthroscopy by appending 59 to the diagnostic arthroscopy. Okay, so this is very important. So here it is simple. Physician will perform the diagnostic arthroscopy first. Okay, so using diagnostic arthroscopy, physician will identify the defect. Okay. So for that defect, physician will not use the surgical arthroscopy. He will perform the open procedure. So that time they are telling that you can code both diagnostic as well as the open procedure. Okay. So if the physician performs surgical arthroscopy, we can't code. Okay. If the physician performs open repair, we can code. So that is the guideline. Okay. So next. So any doubt guys here? 29826. Any doubt?
No.
So here physician is performing acromioplasty. We are having in shoulder area acromion process. See, shoulder subacromial decompression, also called acromioplasty, is a surgical procedure to treat shoulder impingement. So write this shoulder impingement along with your CPT code. A common condition that causes weakness in your shoulder and pain when you raise your arm above your head. It is performed using keyhole surgery. Okay. So arthroscopy other name is keyhole surgery. Okay. So this is the guideline you need to follow here. Okay. So next 29827 with rotator cuff repair. So tell me guys, how many muscles are there in rotator cuff? Important for interviews?
5,
4.
4.
Okay, no worries. Anyway, we need to explain to each and everyone. Okay. So these are the muscles. So this is also very, very important for your interviews. Supraspinatus, infraspinatus, teres minor, and subscapularis. Okay. These are the muscles in the rotator cuff. Okay. If the patient performs this muscle repair, you will code 29827. Okay. Next, open or mini open rotator cuff repair, you need to use 23412. Okay. So when arthroscopic distal clavicle resection is performed at the same setting, use 29824 and append modifier 51. Okay. So they are telling that if the physician performs rotator cuff repair along with distal claviculectomy, we can use 59 modifier for facility, 51 modifier for physician coding. Okay. So that is the guideline here. So if the patient performs rotator cuff repair and claviculectomy, will you code or not? Anyone? Yeah, you need to code. Okay. So next, biceps tenodesis. Okay. So tenodesis means fixation of biceps tendon in the shoulder area. Okay. So 29828. So do not report 29828 in conjunction with 805, 820, 82. Okay. We will check what is this. 805 diagnostic. So 820 synovectomy and complete and partial synovectomy. Okay, so they are telling that you can't code biceps tenodesis along with diagnostic arthroscopy, partial synovectomy, as well as what is this guys? 29822?
Debridement.
Yeah, limited debridement.
Limited. Yeah.
Yeah, limited debridement. Okay, so along with these codes, you can't code biceps tenodesis. Okay, so this is the distal claviculectomy. Distal portion of the clavicle to be removed. This is the acromioclavicular. This is the acromion process. This one. This is the clavicle. So acromioclavicular joint. Okay. So this is the coracoid process. Scapula, humerus. Okay. So like that you need to code. So any doubt guys? Shoulder area. So shoulder is very important. Here most important to guideline is related to this one. What do you call this? Loose body or foreign body. Next one is related to debridement. So they will ask you what is the difference between. So like limited debridement as well as partial debridement. Sorry, extensive debridement. Next, what are the exceptions where you will code extensive debridement along with other shoulder procedures? Guys, any doubt here? These are very important for interviews. So if you don't have any doubt, we will start elbow. Guys, Sweta, what happened? Any doubt?
No doubt. No, sir.
So any doubt, Sweta? Suggest to write down in your CPT book whenever I will tell. Okay, those are very important for interviews. People who are planning to go for interviews, basically. Okay, so if you don't understand, ask me. Okay, so arthroscopy elbow, it is very simple. Diagnostic, here also same. Anyway, you will not encounter arthroscopy elbow procedures in the same day surgery setting. Okay, removal of loose body, foreign body. Okay, same synovectomy, synovectomy. So basically, this synovectomy and debridement you will see in all anatomical locations. Okay, like in knee also you will see this synovectomy and debridement. In hip also you will see synovectomy and debridement. So this is common for each and every anatomical area. Okay, so next we are having arthroscopy wrist. diagnostic with or without synovial biopsy 29840. Okay. Arthroscopy wrist surgical for infection, lavage and drainage. Okay. So in 29843, what is the ICD-10 CM code, guys? What is the diagnosis? 29843. Anyone?
Infection.
Yeah, correct.
Infection,
Yeah,
any abscess.
infection of the like wrist joint. So that time you will use 29843. Okay, as usual. So here also synovectomy partial, synovectomy complete. And synovectomy partial means only part of the synovium is debrided. Okay, so synovectomy complete means physician will remove the whole synovium or synovial membrane. So based on that, based on operative report, you need to code. Okay, so next 29846, arthroscopy wrist surgical excision and repair of triangular fibrocartilage under joint debridement. Okay, so other name for this one TFCC joint. Okay, triangular fibrocartilage joint. So excision or repair of triangular fibrocartilage joint, you will code 29843. So we will check in the quantity, code by 29846 if you have any image or not. So we don't have any image here, so we'll check in Google only. Triangular fibrocartilage complex. Okay, na? So this one. See here TFCC, triangular fibrocartilage complex tear. Okay, TFCC. In the documentation, most of the time you will see it as TFCC. Okay, write down along with your beside your CPT code 29846. You can see as a TFCC for repair, excision, debridement. So here physician may perform any procedure. So he may do excision, he may perform repair, or he may perform debridement. So irrespective of the technique, you can use 29846. Okay. So next 29847, internal fixation for fracture or instability. Okay. Arthroscopy wrist surgical internal fixation for fracture or instability. Okay. So if the patient performs fracture repair using the arthroscopy assistance, you need to code 29847. Okay. So 29848 is very important. Just mark it. Endoscopy wrist surgical with release of transverse carpal ligament. Okay. So most of the time you will see it code as a carpal tunnel syndrome. So your diagnosis will be carpal tunnel syndrome. Okay. For this procedure, we are having two codes. One is for endoscopy, one is for open. So in the documentation, you need to check whether physician is performing open procedure or endoscopic procedure. The documentation contains like endoscopic procedure, you need to code 29848 for endoscopy. Write it here, carpal tunnel syndrome, CTS. For that purpose, physician will perform 29848. Okay. And here for open procedure, you need to code from nervous system 64721. Okay. So next. So arthroscopically aided treatment of intracondylar spine and tuberosity fracture of the knee with or without manipulation, without internal or external fixation. Okay. So here in order to perform intracondylar spine or tuberosity fracture of the knee, physician will use arthroscopy as the aid. Aid means sahayam, like what do you call help. He will take the help of arthroscopy for fracture repair. So that time we will code 29850. So this is without internal or external fixation. Okay. So 29851 with internal or external fixation includes arthroscopy. Okay. You only need to code separately. So we will see if we are having any image 29851. Yeah, this one. Okay. So this is the knee. Okay. Arthroscope and the pins are fixed. Okay. Intracondylar eminence. This one. This is fibula, fracture and tibial tuberosity. Okay, tibia. So this is the arthroscope. Okay. So using the arthroscopic assistance, if the patient performs this fracture repair, you will use 29851. Okay. So here also same. Arthroscopically aided treatment of tibial fracture, proximal, plateau, unicondylar, includes internal fixation. Okay. So when performed, okay. So 29855. So this is also using the arthroscopy assistance. Physician will perform the tibial fracture repair and 29856. So tell me guys, so what is the difference between 855 and 856? So what do you check in the operative report?
Unicondylar and my bicondylar.
Yeah, excellent. Yeah, in the operative report you need to check. They will not mention unicondylar, bicondylar. So you need to check lateral condyle or femoral like medial condyle. So based on that you need to code. Okay, they will not mention I have performed unicondylar or bicondylar like that. So we are having two condyles, correct? Lateral condyle and medial condyle. Okay, so based on that we need to code. Okay, so if the patient uses bone graft along with this 855 and 856, you need to code bone graft procedures. Okay, so these are for bone graft 20900. So we will check once. See, bone graft, any donor area, minor or small. So 29890 is for large bone graft. Okay. So next we are having hip, arthroscopy hip, diagnostic with or without synovial biopsy. Okay. So this is separate procedure. Most of the time we will not code this procedure with other procedures, other hip surgical arthroscopy procedure. Okay. Here also same arthroscopy hip surgical with removal of loose body or foreign body 29861. Okay. So next arthroscopy hip surgical with debridement and shaving of articular cartilage, chondroplasty, abrasion arthroplasty under resection of labrum. So here also physician may perform multiple procedures. So what is chondro? Anyone knows chondroplasty means? So basically chondro means articular cartilage only. Okay. So plasty means repair. So repair of the articular cartilage is chondroplasty. So 29862 includes three procedures: debridement, shaving of articular cartilage, abrasion arthroplasty under resection of labrum. Okay. So that time you will use 29862. So as usual, this is for synovectomy. Okay. So these are very important. You need to remember for interview process. Okay. 29914, 29915. So we are having, what are the joints in the like hip guys? What is hip joint? What are the parts of hip joint? Anyone?
Femur and pelvis.
So what is the other name for pelvis? Acetabulum.
Acetabulum.
Okay. The femur head will go to the acetabulum and it will fix in the acetabular head, acetabular cavity. Okay. So here femoroplasty, treatment of cam lesion. So if the patient is having any type of cam lesion, you need to code femoroplasty. So what is the location for this cam lesion guys? Now tell me, where do you find this cam lesion, anatomical area?
Femur.
Excellent, correct. Femur area. Why means that's why they have mentioned femoroplasty. So this is also important, mark it in your book. So treatment of cam lesion, femoroplasty. So acetabuloplaty, treatment of pincer lesion. So that time you need to code 29915. Okay. So they are telling do not report this cam lesion and pincer lesion repair along with these procedures, debridement or shaving or synovectomy. Why means these procedures already includes these codes. You don't need to code separately. 862 and 863. Okay. Next, labral repair. Like shoulder, we are having acetabular labrum also. So if the patient performs labral repair, you need to code 29916. Okay. So here also they are telling do not report 29916 in conjunction with 15 and this debridement and synovectomy. Okay. Why means so labral repair is included in the all these procedures. You don't need to code separately. Okay. So what do you do? For example, if the patient performs like estabuloplasty and labral repair. So, but here we are having the guideline that you can't report. What do you do in the live coding, guys? How do you code then? Which code you can code? 915 or 916? What is the tip here?
915.
How do you decide 915?
So depending upon the documentation.
And we need
Check
to
the
check.
RPU value.
Excellent, correct. Yeah, we need to check the RVU value. Okay, relative value unit. So based on that, you need to code. Anyway, if you see also, estabuloplasty is the major procedure than the labral repair. Correct? So like that too. But it is better if you are having the evidence. If any time if the denial comes, you can tell them that, tell the client that. So based on the RVU, I have coded this one. So anyway, estabuloplasty is complete repair of the estabulum. Okay, so labral repair is only part of the estabulum. Correct. So anyway, this is more extensive procedure 29915. So you can code 29915 and you can check the RVU value and based on that you can code. Okay. Now we are having arthroscopy knee surgical, osteochondral autograft, mosaicoplasty, including harvesting of the autograft. Okay. So in the documentation you will see it as mosaicoplasty, osteochondral autograft. So what is osteochondral? So osteo means bone, chondral means article cartilage. So bone plus articular cartilage graft. Okay. So for that purpose, you will use 29866. Okay. So next, osteochondral allograft. So this is for autograft. See here, osteochondral autograft. So this is for allograft. We will check one 29866. Yeah, this is the image. So arthroscope, diseased femur bone taken out. Okay. So holes created and cylindrical bone graft harvested. Harvested from here, then bone is inserted. Autograft placed in cylindrical femur hole. Okay, so basically here physician will remove the diseased portion and he will implant the or insert the autograft or allograft. So based on the graft you need to code this code. Okay, for example if you are having the confusion, so you need to check your CDR and you need to code properly in live coding. Okay. Next, meniscal transplantation includes arthrotomy for meniscal insertion, medial or lateral. So how many meniscus we are having, guys? Anyone? 2 meniscus, correct? Lateral meniscus, medial meniscus.
Medial meniscus.
Yeah. So if the patient performs meniscal transplantation, we will code 29868. So always try to check this parenthetical notes whenever you code. Okay. And you can't code this meniscal transplantation along with all these other knee procedures. Okay. So these all are knee procedures which we are going to see now. Okay. So next, arthroscopy knee diagnostic. So as usual, this is diagnostic. Next, arthroscopy knee surgical. So here also infection, lavage and drainage. Sorry guys. So that time you will code 29871. See here. For implantation of osteochondral graft for treatment of articular surface defect. 27 series is for open procedure. 29866 all these for open or arthroscopy, guys. 29866 and 82867. Open procedure or arthroscopic procedure? Anyone?
Arthroscopic.
Excellent. So try to remember whatever the code starts with 29 comes under arthroscopy only. Okay. So 29 starts with arthroscopy procedures only. Okay. So next, lateral release. We will check this one 29873. So the provider examines the inside of the knee joint with an arthroscope to assess the fibrous tissue that holds the patella kneecap. Okay, in place. She incises the lateral retinaculum, the tight band tissue on the outer aspect of the patella to release excessive constriction that causes pain. So now you need to check, we will see here any image is there or not. So just you need to take for lateral retinaculum. So this is the lateral release. See here, lateral retinaculum released. Okay, so this is the release. So if you are having the constriction of this lateral retinaculum, we will have the pain. So that's why physician will release this lateral retinaculum constriction. So that time you will code this code, lateral release. So for removal of loose body or foreign body, osteochondritis discans fragmentation, chondral fragmentation. Okay, you will code this one 29874. Okay, so next synovectomy limited. So in the documentation, if you see plicar shelf resection, you can code 29875. So as it is a separate procedure, you can't code it along with any other major arthroscopic knee procedures. Okay. So next 29876. Synovectomy major 2 or more compartment, medial or lateral. Okay. So you need to check that. So total how many compartments we have in the knee? How many compartments, guys?
4.
3 compartments. Lateral, medial and patellofemoral compartment. Okay. So if you go to interview, they will ask you all these minor questions. Okay. So just you need to concentrate on minimum shoulder and this knee anatomy for your interviews. Okay. So anatomy wise, you need to concentrate on shoulder and knee. Okay. So we are having 3 compartments. So that's why they have mentioned 2 or more compartments. Okay. Synovectomy major. Just in the documentation, you need to see. So in which compartment physician has performed this procedure. Okay. Next, debridement shaving of articular cartilage, chondroplasty. Okay, 29877. When performed with arthroscopic meniscectomy, will you code chondroplasty or not, guys? So using this guideline. So tell me, physician has performed debridement chondroplasty as well as the meniscectomy. Which one you can code? So 29877 or 29880. Anyone just guessing? No worries. So no worries. So here they are telling that, yeah, you need to code meniscectomy. If the patient performs chondroplasty and arthroscopy, you need to code only meniscectomy. You can't code 29877. So that is the guideline here. Okay. Next, abrasion arthroplasty includes chondroplasty where necessary or multiple drilling or microfractures. Okay. In order to perform the regeneration of the bone, physician will perform these microfractures using the drilling. Okay. So that time you will code 29879. Okay. And next 880. These are very important. So here physician will perform the meniscectomy. Okay. Same or separate compartments when performed. Okay. Tell me now. Physician has performed meniscectomy, medial and lateral and chondroplasty. Will you code separate chondroplasty or not?
No need to code
Yeah. No need for
chondroplasty.
chondroplasty. Why means 29880 already includes chondroplasty. We no need to code separately. Okay. So that is the guideline. So this is for medial and lateral compartments. 29880. So 29881. Any one compartment, not both. Medial or lateral. Okay. Same or separate compartments when performed. So medial or lateral. Okay. So this is very important. Whenever you code meniscectomy procedure, you need to check and or. So mark this one and or. So based on that, your code will change. Okay. So next with meniscus repair, medial or lateral. So this is for meniscectomy, like excising the meniscus. Okay. So this is meniscal repair. So here also same. medial or lateral, and medial unlateral 29883. Okay. So for meniscal transplantation, medial or lateral knee, we need to code 2986 site. Okay. So again with lines of adhesions, with or without manipulation, separate procedure. So most of the time we will not code this one. Okay. Next 29885. Drilling for osteochondritis discans with bone grafting. Okay. So in your document you will find this one, osteochondritis discans lesion. Okay. So that time you need to code this one. Here bone graft is included already. So you don't need to code separately. Correct or not? 29885. So it is already included the bone graft. You don't need to code separately. Okay. Next, drilling for intact osteochondritis discans lesion. Okay, this one. Drilling for intact osteochondritis discans lesion with internal fixation. Okay, that time you will use 29887. Okay, so this is the anatomical arthroscopy of the knee. Okay, so this is patella, tibia, fibula, arthroscope, femur. Okay, so guys, so if it disconnects, you can start. So we are having only one page. So we will complete musculoskeletal today, and Saturday onwards we will learn respiratory. Okay, so if it disconnects, you can join again. So now we are having, you need to understand the ligaments. Okay, see, these are very important. So as I told you, knee anatomy is very important for interviews. Okay, so total we are having 4 ligaments in the knee. Okay, cruciate ligaments as well as, what is this, collateral ligaments. Okay, collateral ligaments on the side of the knee, cruciate ligaments are inside the joint. Okay, just here intra-articular ligament as well as extra-articular ligament. So if you go to interview, they will ask you, so what are the types of ligaments in the knee? So what are the types, guys? So write down, we are having anterior cruciate and posterior cruciate. These are intra-articular ligaments. Okay, these are one set. And also we are having lateral collateral and medial collateral. These are extra-articular ligaments. Okay, intra-articular as well as extra-articular. Okay, so 29888, arthroscopically aided anterior cruciate ligament repair, augmentation or construction. So tell me, so 29888, when you code extra-articular or intra-articular? Anterior cruciate ligament, anyone?
Intra-articular.
Excellent, yeah, intra-articular. So all the cruciate ligaments are intra-articular. Only we are having anterior and posterior. So these are intra-articular. Write down here, intra-articular ligament. Okay. So this is for anterior cruciate. This is for posterior cruciate. Okay. So one is on the front side, one is on the posterior back side. 29889 is for posterior cruciate ligament. Okay. Oh, yeah. Next one is this one, 29889, and yeah, this one. Arthroscopy ankle. So now we are going to learn ankle. Okay. So this one, ankle surgical excision of osteochondral defect of talus and the tibia, including drilling of the defect. So we will code this one, 29891. Okay. So next 29892. So arthroscopically aided repair of large osteochondritis discans lesion, talar bone fracture, talar dome fracture or tibial plafond fracture. In the documentation you will see this only. So they may mention talar dome fracture, tibial plafond fracture. You need to code 29892. Okay. So next, endoscopic plantar fasciotomy. Okay, 29823. So now arthroscopy ankle. So ankle contains tibiotalar and fibulotalar joints. Okay, here also same, loose body or foreign body, synovectomy, debridement, extensive, and with ankle arthrodesis. Anyway, you will not encounter this one, 29899. So ankle, most of the time you will not code. Most of the time you will code TMJ, wrist, knee and shoulder. Okay, so this is the fibula and tibia, and here arthroscopy, metacarpophalangeal joint diagnostic includes synovial biopsy. Okay, metacarpophalangeal joint diagnostic. So same here again. Okay, so this is for metacarpophalangeal joint diagnostic includes synovial biopsy. So you can code 29900. Okay. So next arthroscopy metacarpophalangeal joint surgical with debridement. So most of the time you will not encounter this. I told you na, you will encounter TMJ joint, shoulder joint, wrist joint, knee joint, hip, all those only. Okay. Arthroscopy metacarpophalangeal joint surgical with debridement 29901. Okay. So arthroscopy metacarpophalangeal joint surgical with reduction of displaced ulnar collateral ligament. Okay. So this one you will code 29902. Okay. Arthroscopy subtalar joint surgical with removal of loose body synovectomy debridement subtalar arthrodesis. These codes and unlisted procedures you need to use this arthroscopy code. So okay guys, any doubt in arthroscopy? So these are very important for your interview purpose as well as live coding also. Okay. So most of the time you will encounter these arthroscopy codes. So any doubt? Anusha, Lakshmi, Jayasri, Nandini, Shweta, Vinitad, Jansi and Shrikant and Shashi. So any doubt, Shashi?
No.
Clear?
Yeah,
So
it's clear.
Lakshmi,
No, Harish. No.
so Vinita, Jhansi, Shrikant.
No, sir.
Clear na?
No,
Just
sir.
yeah. Interview point of view, you need to know anatomy of shoulder and knee. Must and should. Okay. And you need to know foreign body removal guideline. Ah, sorry, loose body or foreign body removal guideline. Okay. Next, you need to know limited versus extensive debridement differences. Okay. And also you need to know what are the exceptions for like extensive debridement. Okay. So those are very important. So you need to remember and write in your notebooks. Anatomy is very important. Shoulder as well as the knee. Okay. So just always if the patient performs any type of meniscal procedures, you need to check whether physician is performing the meniscectomy or meniscal repair. Okay. And also you need to check whether physician is performing these procedures on the both compartments or on only one compartment. So these are the keywords you need to check in the operative report. Okay.
Okay.
So శ్రీకాంత్ ఏమైనా డౌట్లు ఉన్నాయా? అర్థమవుతుందా? రాసుకుంటున్నావు కదా ఇంటర్వ్యూస్ కి? Okay, cool. So all of you try to write on notebooks or your CPT book so that always try to utilize your CPT book. So if you are using if you are master using your CPT book na, so 90% of your problems will be solved during live coding. Okay, always believe on your CPT book. So that is the thing I can tell here. So